Welcome to our in-depth guide on understanding rabies in cats. Consider your favorite kitty pet, who has always brought you joy and comfort. Suddenly behaving oddly, they may become hostile, confused, or even begin frothing at the lips. Isn't it a terrifying thought? This might be rabies, a fatal virus that attacks the central nervous system of living things such as cats and people. But how much do you truly understand about this disease? How can you recognize the warning signs before it's too late? Most importantly, what precautions can you take to safeguard your pet and your family? Stay tuned as we explore the symptoms of rabies, how it spreads, and the critical safety precautions you must be aware of. We know that the answers to these questions can save lives when needed. That is why we want to share our knowledge and experience with you. What exactly is rabies? The Lissa virus genus is rabies virus causes a viral illness known as rabies. It has an effect on the central nervous system, causing neurological symptoms and eventually death. The virus is found in infected animals' saliva and is most usually spread through bites. Symptoms of rabies in cats. Rabies in cats can be quite frightening and occurs in 3 main stages. Let's analyze these stages to make it easier to understand. First, there is the prodromal phase, which lasts about 1 to 3 days. During this time, you may notice your cat behaving differently. They can be really clingy or, on the contrary, distant. Some cats may run a fever. Their pupils may dilate, or they may obsessively lick where they were bitten. Then comes the rage phase, which lasts about 1 to 7 days. This is when the disease intensifies. Your cat may become aggressive and react frantically to sights and sounds. It may meow much more than usual. He may seem really restless or have difficulty swallowing due to increased saliva. Finally, there is the paralysis phase, which typically starts 2 to 4 days after the first symptoms appear. This is the really serious part. Your cat may start to become paralyzed, usually starting in the back legs or neck. Unfortunately, this leads to respiratory failure, loss of consciousness, and ultimately death. It's important to remember that not every cat goes through all these stages and the timing can vary. But understanding these signs can help to recognize the disease early and seek emergency veterinary care. Rabies transmission. An infected animal spreads rabies most commonly through its bite. The virus is common in the saliva of infected animals, and they infect the host. Rabies can also spread if infected saliva comes into contact with an open wound or the eyes, nose, or mouth of another animal or person. Precautions and safety precautions. Let's try to talk about ways to protect your cat from rabies. It's all about prevention. The #1 tool we have is vaccination. Here's a quick primer on how it works and why it's so important. First of all, kittens should generally receive their first vaccination between 12 and 16 weeks of age. This first injection primes the immune system to recognize and fight rabies upon contact with the virus. But it doesn't end there. Cats need booster shots to keep their immunity high. Depending on the vaccine and where you live, this may happen every year or every 3 years. It is very important to stick to the schedule to protect your cat. There are now different types of rabies vaccines, such as killed virus and recombinant vaccines. Your vet will know which is best for your cat, taking into account your cat's health, lifestyle, and local laws. Speaking of laws, in many places it is mandatory for pets to be vaccinated against rabies. The important thing is to keep both pets and people safe. It is very important to keep track of your cat's vaccination history. Write down when they got the shot, what type of vaccine you got, and when the next shot will come. This information is crucial for vet visits, travel, boarding treatments, or if your cat bites someone. Most of the time, rabies vaccines are safe and work great. Some cats may feel a little sore or tired after getting the vaccine, but serious side effects are rare. If your cat has had problems with vaccinations before, talk to your veterinarian about this. By vaccinating your cat, you not only protect him, you'll also help stop the spread of rabies to other animals and people. Another big part of keeping cats safe is being wildlife smart. Teach children not to touch or approach unfamiliar animals. Try to keep your cat indoors or supervised when outside. This helps reduce their chances of encountering a rabid animal. Emergency treatment of bites. Okay, let's talk about what to do if your cat gets bitten. It is important to act quickly and wisely to prevent the possibility of rabies or other infections. First, make sure your cat and everyone around is safe. If bitten by a wild animal, stay away from it and do not try to catch it. Then gently check your cat for any bite marks, scratches, or injuries. Remember, even the sweetest pets can attack when injured. Go directly to the vet, even if the injury seems minor. Animal bites can be more serious than they seem, especially if there is a risk of rabies or other infections. Tell your veterinarian everything about the incident. such as what attacked your cat and how it happened. Your veterinarian may recommend a rabies vaccine, even if your cat's vaccinations are up to date, just to be safe. Monitor your cat closely after the vet visit. Watch for any strange behavior or signs of illness. Keep your cat indoors and away from other animals until it recovers. Remember, acting quickly can make a big difference. So stay calm, act quickly. If you have been bitten or scratched by a cat, start immediately by cleaning the wound. Take some soap and water and wash for at least 15 minutes. This may seem like a long time, but it's crucial to getting rid of nasty germs, including the rabies virus. If you have an antiseptic solution, use that too. The next step is to go to the doctor, even if the bite seems minor. Tell your doctor everything about the bite, such as what bit you and how it happened. This information helps the doctor understand your risk of rabies and what treatment you need. They may recommend a tetanus shot, rabies vaccine, or antibiotics to keep you safe. If the animal is a wild animal or a pet you do not know, you should report this incident to your local animal control or health department. They may need to check certain things, especially if the animal may have rabies. Keep track of everything about the bite. When the bite occurred, what the animal was like, and what treatment you received. This is very important for your health records and may also be required for legal reasons. Finally, follow all medical advice you receive. Finish the medications they give you and go back for follow-up appointments. Watch for any signs of worsening, such as more redness, swelling, or pain. Remember that quick and accurate action is the key to preventing serious problems in the future. General considerations. The situation can be serious when it comes to dealing with rabies and animal bites. First, understand how rabies spreads. It usually happens through the saliva of an infected animal, bites, scratches, or even open wounds. Rabies is almost always fatal once symptoms appear, so you must act quickly if infection is a possibility. Learn the rules in your area. Different places have different laws about reporting animal bites and how to treat animals suspected of being rabid. Following these regulations will help you do the right thing quickly in a stressful situation. Prevention is always better than cure. Keep your pet's rabies vaccinations up to date. Monitor them closely when outdoors, and stay away from wild or unfamiliar animals. These simple steps can significantly reduce the risk of rabies. If an animal bite occurs, emergency care is very important. It's not just about treating the wound. It is about preventing serious infections such as rabies. If you or your pet is bitten, don't wait. Contact a doctor or veterinarian immediately. When in doubt, always choose safety and seek professional help. If you encounter any stray animals or notice any strange behavior, report it to local animal control. They are equipped to handle potentially dangerous situations and can help prevent the spread of rabies. Cats suspected of having rabies may need to be isolated for a period of time to monitor for symptoms. Rabies is a scary thought for any pet owner. It can also affect humans